Hi, my name is Caitlin Dale and this is video 37. So today we are doing a dental procedure on Axel. So I am first going to check his identification against the documentation that I have here. So Axel is a male desexed white Japanese Spitz. He's 9.5 kilos and he is 8 years and 4 months old, and that documentation matches his identification. I am now going to pre-fill out his dental chart here. So I am going to pop on the date, so the 29th of the 3rd, 24, the patient name, Axel, and the surname, and the client name onto the form here. And I will also pop down his patient ID number. The presenting complaint today is slight build-up of plaque on his carnassials and his canine teeth that the owner has noticed. So that's what we're going to be addressing today, as well as just giving all those teeth a clean. And popping down current home care is really important as well. So he's already on those TD Bickies, he's on OxyFresh. He's also on some bones every now and then, and the owner does find it a little bit hard to brush teeth at home, so it's always a good idea to pop that down, because then you've got an idea of what they're doing, and that way you can have a little think to see what else they can do if needed. As you'll see, so I'll show you my little pre-filled chart with all of that information on here, and that was his documentation that I was looking at as well. As you'll see in the video that follows, I am wearing my PPE, so I've got eyewear, a mask and gloves on as a minimum. So it's really important to wear your PPE. So you want to protect your eyes from sort of any high-speed burrs that may fracture and injure your eyes. There's lots of aerosols generated during dental procedures from the rotary instruments and all the water coolant. So protecting yourself from the pathogens there with your mask is really important. And obviously you want to pop your gloves on to prevent sort of contamination from your hands into the mouth of the patient as well. Caitlin Dale, resuming video 37. So now my patient here is anaesthetised. I am going to do an oral cavity exam. So first I am going to check the lips, the cheeks, the hard palate, the tongue, so on top and underneath, and the gingiva. So no abnormalities. I am now going to check each tooth individually and record my findings on my dental chart here that I have already pre-filled. So for the purposes of this video, I am only going to do one premolar, one molar, one canine and one incisor. So first I'm going to do my calculus scoring, just because if there is too much of a heavy build-up, I will have to remove that first before checking the teeth any further. So I would give Axel his premolar here, so his 208, so 8th tooth in the second quadrant left maxilla, a calculus grade of 1, so slight build-up here. I am now going to check the gingiva, so I can probe and just have a look and see if there's any redness. So I'd probably give him a gingiva grade of 1. There is slight bleeding here and a little bit of redness when probed. So whilst I do also have the probe here, I am going to check the periodontal probe depth. So I'm going to pop my periodontal probe into the sulcus until I can feel resistance, and then I'm going to have a little look at the millimeter graduations on the probe. So he has got a periodontal probe depth of 2 millimeters, so I'm just going to mark that down on the form here. So he's got a calculus grade of 1, a gingiva grade of 1, and he's got a periodontal probe depth of 2. I am now going to just run my periodontal probe around the whole circumference of the tooth to to check the depth all the way around. And now I am going to check with my probe as well the furcation. So I am just going to pop that through here, and he's got a furcation grade of 0. And I'm now going to use a blunt end of the mirror here just to check the mobility of the tooth rather than my finger. And he's got a mobility grade of 0 as well. So I'm now going to do that for the molar, so here's 209. And then I'll also do the canine and an incisor. Moving on to the canine. Clarification because it's a single rooted tooth. Caitlin Dale, resuming video 37. In my clinic, we use the Triaden 3-digit numbering system. So the first number of that system does indicate which quadrant of the mouth you're talking about. So number 1 is the right maxilla, number 2 is the left maxilla, number 3 is the left mandibular, and number 4 is the right mandibular. The second and third number in that system does indicate which tooth you're talking about in that quadrant of the mouth. So for Axel today, we have marked down his molar, premolar, his canine and his incisor, as you would have seen in the video. So the system, the Triaden system, does have codes for what you're sort of marking down for each individual tooth. So you would have seen in the video that I wrote CN, so that is the calculus scoring, and that can be anywhere between 0 and 3. I've also wrote GN, so that's for the gingival scoring, so again that can be between 0 and 3. I've also popped down PPD, so we use that for the periodontal probe depth, so that can be between 1 and 3 in dogs. That's absolutely normal. Anything more than that does indicate some recession there of the gums. Or some little perio pockets. The furcation, so that's marked down as FN. So that's where that periodontal probe does sort of slip through the multi-rooted teeth because there has been some bone loss. That is only on multi-rooted teeth. And then MN is for mobility. So that's again marked between 0 and 3 just to see how much movement there is in that tooth. With the furcation as well, sorry, that is also sort of graded. So it does just depend sort of how far your probe does slip through, and that's again graded 0 to 3. Just with the scoring there of the individual teeth, for furcation. With the multi-rooted teeth, you would have seen in the video that I marked down just one number. So when you are going around the whole circumference of the tooth, some practitioners will prefer you to write down one single number. Others may prefer you, where the depth does increase around the tooth, to at least record four sort of recordings for the tooth. For single-rooted teeth, you know, one number is probably suitable, but for those multi-rooted teeth, 4 is probably more suitable and accurate. But just yeah, my vets in my clinic do prefer just one number. Post-treatment dentition, so that's really important. In my clinic, our charts actually only have one sort of image of the tooth here and one area to write down your treatment. But ideally you will have a chart that has the post-treatment as well. I could always use a different chart if needed, but it's really important for us to be able to mark down what we have completed. So you may have been planning in an extraction, and then you've put a line through the tooth that you're planning to extract, and then you know on the post-dental you can then complete that into a cross to indicate that you have removed that tooth. It's also really important for you to mark down on that post-treatment as well anything that the owner really needs to keep an eye out. So for any teeth that may potentially have a bit of furcation there, any gum recession, any sort of perio pockets, etc. But it's something we are working on in my clinic. Yeah, thank you.